Hi, everyone on Facebook. I'm just making sure we're broadcasting. So just give me 1 second here to make sure. I hope everyone's having a great day. The sun was out for a little bit, but it's gone away again. So hopefully it comes back. But there's definitely 5 weeks left till spring, which is really exciting. And I know that because my daughter's going to be born the day before spring. And we have 5 weeks left of our pregnancy, which I can't believe it's already here. Okay. So it shows that we're live on Facebook. Yeah. Perfect. Let me just share this to one more group and then we'll get started. Okay. So today we're going to be talking about something that I see come up a lot. So if any of you have any scars or have had a C-section yourself, you may know what I'm talking about. There we go. Okay, perfect. So my name is Nicole Alfred. I am a registered massage therapist. I've been in practice for 15 years. I have a special interest in my practice working with patients as they go through the perinatal period, which means women while they're pregnant, fertility, pregnant, birth. I'm also a birth doula, and in postpartum as well. And I also work with babies, which is really exciting. So I wanted to talk to you guys today about dealing with numbness around your cesarean scar. Now, this is something I'm a part of quite a few groups on Facebook where they talk about different things related to cesareans, recovery, prep. Some people ask other questions. It's just a lot of communities. And one of the most common things that come up, other than the fact that they don't like their C-section scar shelf on their tummy, some of you know what I'm talking about if you've had a cesarean, is the, hi Gina, is the actual numbness around their scar. So this is very common. And the reason why this is common is because if you look at the scar, where is my little, I had that demo that I showed you guys a few weeks ago. And of course, don't know where it is right now. Do I? No, I don't. Anyways, I had that demo a few weeks ago showing you guys the different layers that are being cut into with a cesarean. Therefore, we're cutting into blood vessels and nerves and all that sort of thing. So it's very common after having a cesarean and your body is healing and the scar is closing nicely and healing for there to be numbness. Now, some people, if they've done some of these things that I'm going to suggest today, which I did with my first, they don't have any numbness around their scar. So the numbness is usually felt. So say this is your C-section scar. This is above your C-section. So there's like your belly button up there. And this is below. So down here is your vagina. So usually the area just below and just above the scar and maybe even around and even on the sides of the scar, it's very common to feel numbness when you're running even your fingertip along that area. It can feel numb if your clothes are touching that, I find. Some people complain about just the sensitivity of their scar and the skin and having just their clothing touch it can feel very numb as well. And irritating and itchy, right? So these are all very common symptoms. Have any of you guys experienced numbness around a cesarean scar or any scar in particular? If you've had surgery, let me know. What have you guys done to help ease that discomfort? Let me know. So the itchiness is definitely common as well. You want to make sure that your scar as it's healing is kept dry, but the itchiness can also be like the nerves are trying to grow back. So the nerves do grow back, and we want to encourage them to grow back. We don't want to be feeling the numbness for years to come. You don't want to be reminded every day that you have a scar there. You want to feel like it can just be integrated into your life, like it's a normal part of your body. So what is nerve desensitization? Does anyone know what that is? I don't know if it's going to come up. No, it's not coming up is the right word. Nerve desensitization. So if you guys look it up on Google, you'll get the very formal meaning, which is it's a treatment technique used to modify how sensitive an area is to particular stimuli, like touch. This technique is utilized to decrease or normalize the body's response to a particular sensation. So when we touch something, oh, that's so great to hear that you're a birth doula. So when we touch something, our brain responds to that. And when we have had surgery and the nerves have been severed, sometimes there's no response going back to the brain because the nerves haven't regrown to that area. So nerve desensitization is basically using massage, different temperatured waters, different textures to bring that feeling back, to encourage the nerves to regrow. And these are the things that are going to help decrease the numbness and itchiness around our scars. This is what I did. I had a pretty extreme trauma during my cesarean, so I wasn't able to do a lot of stuff maybe the first 2 weeks because I had a really hard time standing. But it doesn't matter because I find that if you can start this at any time, you may get some feeling back. You may help with some of the numbness. So don't worry if you're already, 4 weeks after your cesarean or 6 months after your cesarean. Let's try some of these techniques. Maybe send me a message if you're using it over a month period and you've seen a difference. Like, let me know because this is definitely something that can help. So the first thing we're going to do is talk about the healing of your scar before we do any nerve desensitization. Wow, I'm going to have a hard time with this one today. Sorry, when I'm pregnant, I can't whistle. And so when I'm trying to say certain words, my tongue doesn't roll. It's really weird. It's a pregnancy symptom for me. See, look, I can't even say that. So anyways, what we're going to talk about is how your nerve, so pretend this is your cesarean scar right here. So we've had the incision, you're now home from the hospital. It's been maybe 2 weeks or 12 days. And you want to definitely make sure that we're starting to see unionization of the tissue, which means we want to make sure we're seeing the tissue come together. No signs of infection. So clear fluid is very normal to come out of the wound. Any pus, any smell, any heat, redness, inflammation, swelling, fever in your body, like these are all signs there could be an infection. So we want to obviously not do too much around this area when that's all happening. We want to make sure that the scar is healing very healthy and that the tissues are closing together. When you're working with a new incision, a new scar, you can start using the different textures right away, but you want to make sure that the pressure you're using is going towards the actual incision. So if I'm doing anything kind of between my belly button and my incision, I'm pushing down all of my pressure towards the incision. Same from below, if I'm working from where the vagina is to the incision, I'm going to be pushing all of my techniques up towards the incision, okay? So the first things that I usually suggest is using your fingers, just with no cream or anything on it, and just kind of feel around your scar, see how it feels, what kind of feelings does it give you, what kind of sensation are you feeling. You're welcome to make a note of this or just a mental note of how this is all feeling because you want to know where you're starting from, right? Sorry, my arm's getting tired. I didn't think about this one. I should have used a demo. Where are we? Here we go. So once we've done that, and we've kind of gauged how our scar is feeling, how the skin around our scar is feeling, then we can start using some textures. So I usually have like a rule of 3 different textures because I don't want to overwhelm people. So the things that I like to use initially would be something like a face cloth, okay? Dry face cloth, you don't have to wet it. If you find that your scar is very sensitive or that you do have a bit of infection showing, you're welcome to just use water. So you can use warm water and cool water. If you have a shower head that it detaches there, use a gentle pressure of the water and you can just gently do some warm and some cool kind of up and down around that scar just to kind of get the different temperatures interacting with the nerves there, because we don't want to just touch. We want to also have like temperature feeling as well. Because I've heard some people say, like, I can feel, the feeling of your hand, but I can't really feel when there's cool water or warm water. So that's another thing too. So you can start with water if you are nervous to even touch it, or there is a sign of infection and you want to use water because it cleans it anyways, then do that. So I usually roll up my face cloth, or you can use a baby face cloth because they're super tiny. And I just take the corner of it, and what I'm going to do is just brush towards my scar. You can do this when you get out of the shower. Sometimes I was doing this stuff in the shower, like before I actually wet my body, because that was the only time I could remember to do it, because I was trying to do it very soon after my cesarean. And you know what it's like being a new mom, or if you've worked with new mothers, their brains aren't really working. So if you're going to suggest this to people, friends, I know you said you're a doula, if you're suggesting it to patients, definitely give it like as an easy kind of part they can add into their daily routine. And so you're just going to brush towards the incision, not necessarily going on top of the incision, but close to it, and then from below. Okay? And so you can do this like back and forth 3 times, 2 times, 4 times, whatever you can tolerate. Go slow, and go at your own pace. And if you find that's all you can handle for the first week or 2 or 3, then just keep using the same texture. Eventually you want to graduate though. So eventually you want to get to something like a dry brush. So dry brushes usually come like this from the drugstore. You're not supposed to actually wet them. They're actually meant to be dry. They help to clean dead skin cells off your body, and it's great for a lymphatic system as well. Normally I wouldn't use this. I do have my son's like little kid. It's like probably about this big, and it's a hairbrush with the same kind of soft bristles. But because I couldn't find it, this is what we're using today for demo. So anything with like a soft, natural bristle. I think his hairbrush is even a bit softer than this. So really just see what you can handle, right? So what you're going to do again is you're going to brush down towards the scar. Hopefully by the time you get to the point that you're using a dry brush or a soft bristle brush, your incision is fully healed, closed, no signs of infections, maybe you're even past 6 weeks. Again, if you're doing this at 6 months, you don't have to go at such a slow pace, and you don't have to worry too much about pulling on the scar. If you're after at least 12 weeks and your skin is unionized and you have no signs of infections, follow this, but not so cautiously. And you can actually probably go all the way over your scar. So this is just if you're doing this within the first 12 weeks, okay? So again, we would go towards the scar if this is under 12 weeks post-cesarean, okay? So this is another texture. The next texture I like to use is a comb. So usually it's a man's comb. If you have your own comb because you have short hair, that's great. You can get these at the dollar store. My husband doesn't actually have hair. He's shaved head. But my son has hair. But anyways, these are cheap at the dollar store. So if you don't have one, you can always get one. And again, we're using the different textures. So this one actually has like a couple of different bristles on it. So these ones are a lot closer together. These ones are further apart. So you may want to start with the ones that are further apart because it's going to be less stimulating to your nerves. Okay, so you would just do the less stimulating side of your comb first as you're massaging around your scar, and then you would flip it if that felt okay, and you could go up to the next level, which would be the one where they're more closer together, right? Because your nerves in your skin are all spread out, right? Like they're not kind of, it's not like the nerves that supply your muscles, where it's like a nerve with branches off from that. The skin nerves are kind of like all over, spread out. So when you're using something with more of a broad pressure on it, like your finger, you're not being as specific and overstimulating to those nerves. When you're using something that has little bristles on it, or like this, you're actually going to be really stimulating those nerves there, okay? So the next thing I even would use, if let's say you don't have a dry brush, you don't have a comb, is one of these exfoliating gloves. You can feel it has a bit of a texture to it. You could even start with a regular cotton glove and graduate to one of these gloves. Wow, my hand's really big. doesn't really fit well in this. Clearly, I don't use this on myself, but it's in my drawer. And again, you can use fingertips towards the scar. If you're, a little bit further along in your healing, you can use your whole hand over the scar. So I'm just giving you guys some options of what you can use or what you can just suggest for people to use as they're healing, okay? And then another one that I like, so we've talked about face cloth, we've talked about a soft bristle brush, we've talked about a comb using the wider, more separated sides before we use the ones that are closer together. We've talked about using an exfoliation glove and maybe a cotton glove. Another thing is too, we have these little balls, these massage balls that have the little knobs on them. If you are past 12 weeks and your incision is closed and you want to start doing some massage over your scar, because it has the little knobs on it, it's going to be more stimulating than a round ball that doesn't have any knobs, okay? So something like this is really great. I think it's called AccuBall or something. Yeah, AccuBall. And again, you're just going to roll all over your incision. I think you can heat and cool these. So if you wanted to try that as well, that might be a good idea. You can do circles. You can go straight across. You can go up and down. And you can keep applying more pressure as the weeks go on. And then I love just using my hands to massage. So sometimes you put a bit of cream, especially if you're putting some oil or cream after your bath or shower. And you can just do some massage over the scar. Again, this is after 12 weeks. No signs of infection. The tissue has closed, and you're able to tolerate massage over it, okay? So I really don't want you moving away from like the first maybe 1 or 2 textures until you can really handle it, until it doesn't feel numb or like make you feel grossed out or make you feel like you don't want to touch it. It's a part of your body. It's a scar. It's a scar that was made to bring a baby into this world. So it's a beautiful thing that you can have that you'll always see to look at. Try to change your mind about it being ugly and not attractive, and look at it more as something that is a part of your body now. It gave life to a human being, and that you do have tools to help make it feel good. Okay, so we have to have our mind focused in that as well. That we have to have the intention. We want to make it feel good. We want to help with these symptoms. And I'm hoping that with you doing this, try doing it every day, because you're going to do it in the shower or whenever you shower. If you don't shower every day, do it every time you're in the shower, and you don't have to do it long. Like, it doesn't have to be this whole session. It could just be like, how you put your deodorant on when you come out of the shower, or how you brush your teeth every morning. Like, just make it a part of that. Make it simple, make it easy. And then you have a higher chance of succeeding and making this a part of your routine. And then hopefully that you'll start to see the differences. You won't have any that itchiness, that numbness, that loss of sensation or sensitivity to sensation as you did before. Okay? So if you guys have any questions, please feel free to reach out. On Instagram, you can DM me. Here on Facebook, again, you can privately message me. I do have a program coming out before April. And it's a heal your scar to restore your core program. And it's a full program video with manual on how to desensitize your scar, how to help with the scar tissue and adhesions that are in the scar so that you can function better, so that your core can be restored. Okay, so I will let you guys know when that's coming out. Stay tuned. You can follow me here on Instagram, on Facebook at Fully Alive Wellness. I do have a private Facebook group for just people who've had cesareans or who are preparing for a cesarean, and it's called C-Section Moms Plan, Support, and Recover. So if you have not had a cesarean, I unfortunately will not allow you into the group, or you're not preparing, I won't allow you into the group. I'm very protective over my people. And it's just a really great community, supportive. It doesn't matter if you've been 6 years post-cesarean, because there's definitely relevant information in there that you can receive and maybe that you can share because you've been through it with people who've never been through it. Thank you all for joining me, and have a great afternoon, and I will see you next week. If you have any suggestions for topics, please feel free to let me know. I love talking about this stuff, as you can tell, and we'll be in touch. Thanks, everyone.